Hi, I'm Dr. Paul and thanks for tuning into this video from Waterfront Dentistry by Paul's. Today I'd like to talk to you about tooth decay. Now, there are three factors that cause decay. The first is carbohydrates or sugars. Now, we all consume carbohydrates in our day-to-day diet. Some people have a sweet tooth, some people not so much. And there are different kinds of sugars that form carbohydrates. There is sucrose, which is the most common kind. There is fructose, which is from fruits. There is maltose, which is from milk. The second is a certain kind of bacteria which everyone has in their saliva called Streptococcus mutans. Let's call that the sugar bug from now. And the third is thyme. As far as carbohydrates go, we all have to eat a certain kind of sugars in our diet just to sustain ourselves. Some people, like I said, have an excessive amount of sugars in their diet. They like pop, they like to eat dessert. A lot of people like to eat pasta. All these things form carbohydrates or sugars. Second is, of course, like I said, the sugar bugs. Two identical people might have different amounts of salivary bacteria, and that's why they have different kinds of caries or decay risk, even if they have the same diet. Now, this is really important because there are so many people who tell you that I brush, I floss, I try to eat right, but I still end up getting cavities every time I go to the dentist. And you might have another group of people that tell you, well, I hardly touch the toothbrush, but every time I go in, there's really nothing much for the dentist to do. This is basically the reason why. It's inherent to the amount of bacteria in their saliva. The third, of course, is the time factor. Now let's stitch all these three things together. Whenever you have any kind of sugars that ingest in your mouth, the bacteria in your saliva is using this sugar to cause lactic acid. Now, enamel and dentine are one of the strongest minerals in our body, but they are very susceptible to lactic acid. So when you consume any kinds of sugars and you have a lot of bacteria in your mouth, you have a lot of acids that are formed. Now, acids, how they work on enamel is they cause microporosities or small little holes or baby cavities, which eventually coalesce together and become full-blown cavities. No one really wakes up one morning with a hole on their tooth. This process usually takes weeks, months, or years, again, depending on the amount of bacteria you have in your mouth. Whenever you do have any consumption of sugars, there takes a minimum amount of time for the salivary buffer agents to neutralize the acidity in your mouth, and that's where the time factor comes into play. Usually it's around half an hour. Sometimes it might be more if you have more frequent consumption of sugars. The whole thinking about if you consume anything sweet for over a prolonged period of time will give you less chances of getting decay is completely not true. You might have less chances of getting weight gain, but not of decay. In fact, it's completely the opposite. If you are someone who cannot resist a can of pop a day or a candy bar a day, we'd rather have you eat that candy bar or drink that can of pop within the first half an hour rather than sip on it through the rest of the entire morning or the afternoon. So now that you know briefly what causes decay, you will also know how to avoid it. Is it possible to eliminate one of these factors? In theory, yes, but think about it. You can never really say no to carbohydrates because we all need sugars to live. You can never really take out all the bugs in your saliva, and you can never really brush your teeth as soon as you ingest anything. I mean, technically you could, but you would be stripping a lot of your enamel away, causing more damage than good. So an ideal balance between good diet, proper oral hygiene, and a certain mechanism where if you go to the dentist and they identify you as a higher cavity risk, a certain kind of mouthwashes can be used to prevent or decay or decrease the amount of bacteria in your saliva. So if you ever have any doubts about if you're at a high cavity risk, talk to your dentist and maybe they can figure out why. Thanks for watching.